Okay.
Okay. So to get started, I sent out the documents that have all the questions from the OQEs for chapter 1, 2, and 3. So you should have all of the questions. All of the exam questions did come from those 3 documents. So that can definitely help you out as you try to prepare for the exam. I believe that because let me actually see if I can pull it up. I don't know if I can be on Zoom and pull up the exam at the same time, but let me check. Oh, I can. Okay, perfect. So I will tell you exactly. So there's 41 questions in total. And let me look at it. 3, 4. And 4 of them are short answer. So of the 41 questions, 37 are 1 point each. They're multiple choice and true false. There's probably a little more multiple choice than true false, but it's close to half and half. And then those 4 questions range between 2 and 4 points, depending on how much is expected. So for example, let me take a look. Like if I'm looking for like 2 specific responses to that essay question, then it's worth 2 points. If I'm looking for 3 things, then it's 3 points. So you'll know how many specific things you need to answer based on the number of points that it is. So if you're like, oh, this question, I don't know, is it 2 or 3 things? And it's 2 points, that means I'm looking for 2 things. If it's 3 points, then I'm looking for 3. So that's it about the exam in general. So I'm wondering if you all have any specific questions that you wanted to ask about the exam.
I feel like I had one.
So just to clarify, Dr. Christina, the questions are coming from the answers that you sent us, or the exam questions that we created?
So it's the exam questions that you all created. I put them into documents. I'm losing track of days. So it was either this morning or yesterday. I sent out an announcement with, it says exam questions 1, exam questions 2, exam questions 3. And those are all of the questions that you all submitted for the exam questions. So it's basically like looking at the discussion post, but I put it all together so you have it like in one place.
Thank you. I appreciate that.
And all of the exam questions that I included come from those 3 documents.
Okay. Even the short answer ones that you were saying, right? When you're looking
Yes,
for like
correct.
2 or 3. Okay.
Yeah, the only difference that there might be is like maybe someone submitted a multiple choice question and I changed it to a short answer one, or they submitted it as a short answer and I changed it to like a true false or a multiple choice. So they might be in a slightly different format, but all of the questions come from the ones that you guys submitted.
Okay. I just had a question about the dates of these quizzes. Like, do you post them like as we go through the semester? Because I was looking for them in the calendar and the syllabus and I couldn't find them just because I kind of like
Yeah.
to.
So what I did when I adapted this course to like the online format, I kept the same structure that there had been in past semesters, where the quiz was opening on that Friday and then it was just open for like 24 hours. And I did actually move it a little bit longer. I think I kept it for the whole weekend. But I've realized like this week that I don't really like that format. Like typically I leave an exam open for a full week. And then that way students can choose when they'd like to take the exam that week. And so I think what I'm going to do for the second quiz is we'll probably plan the Zoom meeting for maybe during week, let me see, what would it be, 5, 6, 7, and then have the exam open complete for the full week 8, because I don't know. I mean, I don't know how you all feel about it, but I just didn't like this. This didn't feel good, where it was like, quick schedule a Zoom and then the quiz is like just on the weekend. That doesn't give you a lot of options. Like if someone had stuff to do this weekend, then that makes it really tough. So I'm going to switch it for the next exam. And then if you all like that kind of format better, that's what we'll keep for the last 2 exams.
Okay. All right. Thank you.
Yep. Any other specific questions about the exam or even general ones?
I have a question. More like, so I guess that for the various questions for each of the chapters, so some of us, and I know I did that, I think with chapter 1, I posted the questions, but I didn't post the answers. And so I see that, I mean, students did that from chapter 1 to chapter 3. So I mean, I guess I'm going to answer my own question. We just look for the answers, and that's all we have to do, right?
Yeah, like some of the questions, students did put like what the correct answer was, and so I did leave that on like the sort of study guides that I sent you. But if a student didn't, I didn't, because unfortunately I was putting those together while I was traveling and I didn't have access to the book, and so I didn't want to select like the wrong answer to give you guys to study. So I figured it would be better for me not to write the answer and have it be wrong. Again, for the next exam, I should not be traveling during that time. And so I'll have the book with me and be able to like give you a better study guide where it'll actually have the question. And if the student submitted it and didn't answer it, I would give the answer. So again, next time it'll be a little bit more, I think, I want to say organized than this time. But again, I don't want you all to think that, that if this exam, like, there's a number of students who didn't do well, or a question that just really didn't seem to go over well, like a lot of students maybe got it wrong. I take those things into account. Canvas gives me statistics, all of the exam questions. And so if there's questions that just really didn't do well, then I would throw those questions out. So I don't want you to feel like, if it's something that the book didn't explain well, or maybe, it wasn't answered on the study guide, and so a number of students got it wrong, that I would hold that against you all. And so I'll make sure that I look at that after everybody has completed the exam. And I go through and I grade those like short answer questions. I'll see if there was anything that needs to be thrown out and let you all know that.
Okay. I have a question, but it's not really related to the quiz. It's related to the discussions.
Okay.
And so when we provide, like for the sex box discussion number 2, in the answers, are you looking for us to integrate specific information from the chapter, or just like general knowledge that we have acquired? Because I think that like some of the scenarios are very, we can reply with the general like knowledge that we've gained so far in the program, but there's also an opportunity to be very specific, to integrate or to apply material from the chapters that we've read from chapters 1 to 3. Mm-hmm. And so when you grade that, do you take that into account? Like if someone is putting in their information they've learned from the chapters, it's a different grade.
So I feel like the purpose behind the sex box discussions is to try and help get you used to talking about these topics, and really thinking about like, this is something that a client could say to me, and how might I respond? Like, what would my first reaction be? And if I didn't know the answer, where would I find the answer, or like, where would I guide them to? And so you can definitely use information from the textbook. You can use information from other sources, but also if it's something that you already kind of know the answer to, and you're like, oh yes, this is how I would respond to a client, I would explain X, Y, and Z, then that's fine. more of, I think that knowledge is obviously important, right? So you're in a counselor program and you're learning how to be counselors, and there's lots of things that, you know, you should have knowledge about. But I think that a big part of being a counselor is really understanding yourself and how your own expectations, your own beliefs, your own biases will impact the relationship that you have with clients. And so if a client asks you this question and your first response is to be, you know, oh my gosh, or I've never heard that before, or whatever, the client might react in a certain way. And so you can be honest on the discussion post and say, honestly, I've read this and was shocked, or I was horrified, or whatever. But then follow it up with, you know, I recognize that means I need to learn more about this topic, or I need to get myself more used to talking about something like this, or, you know, identify resources that I can use with clients if this were to ever come up. And I think that that's what I hope that you gain from those discussions. So again, it doesn't have to be like, you know, a proper citation from our text or anything like that. It's more of like, you know, either I'm comfortable with this and this is how I would respond, or this is something that I really need to gain comfort in, and I want to be able to explore this answer a little bit more, or whatever. And also your responses to each other would probably reflect that. So if you write in your response, like, you know, I was shocked by this. I never thought that this is something that a client could say to me, and I don't know how I would respond. And, you know, this is an area I need to learn about. Then someone else might comment on your post like, oh, here's where I found knowledge on this about, like, maybe you can check this out. So it's a good way to also be supportive of one another. So if you know things about that topic, or you know where to research it, or find that information, share that with your peers. And so what I plan to do is to go back through and like read the thread as it is. And if there's like one of the questions that, really stumps most of the class, where, most of the class was like, I don't know how I would respond to that or whatever, I'll be able to jump in and say like, oh, hey, this might be a good thing to do, or this might be a good way to like engage the client in that discussion, or give them resources. So definitely go back at some point to those text box questions and just see like where I might have jumped in. The other way I could, well, I guess there's two ways I could do it. Instead of doing that so that you guys have to look for it, I could probably do something similar to the OQE questions, where I put the text box questions into a Word document and then talk about it. Maybe I'll do that so it's a little bit easier to find. You could just go to the announcement. So that's what I'll do. But yeah, it's really just more about, your personal growth as a counselor.
Okay.
Yeah. So I know that was a long answer to a short question, but
That's fine. Thank you.
Yep. Does anybody else have any questions? And of course, they can be about other areas of the course as well. If you all don't have, a lot of questions about the quiz.
Question. I'm trying to find it on my study guide.
I do have a question, and it's not related to the quiz. And so in the chapters, there is discussion about it's highlighted the importance of working with individuals from taking like an interdisciplinary or multidisciplinary approach to addressing clients' concerns. Mm-hmm. And so there, I think in both in chapters 2 and 3, there are certain sections that address if the client, for example, doesn't feel comfortable talking about to their primary care physician or a physician they're seeing about certain sexuality related concerns, that maybe the client will grant us permission to, the client will sign a form and then we can contact the physician. So I wanted to ask you, I think that medical, healthcare is really fragmented, and how can we, so that's something that's the question that I've continued to have, how can we actually go about establishing some sort of connection with the healthcare professionals that are seeing our clients, if there's ever a need for us to have to connect to speak to them?
So in my experience, when you work with agencies, especially if you take Medicaid clients, like the state funded insurance, it's going to be policy that at the intake, you're asking clients if they'll agree to sign a consent to talk with their physician or other specialists they might work with. And so when you're in private practice or, maybe in like a group practice or something where you get to make your own decisions about that, I do believe that it's still a good idea to ask clients at the intake, are there other providers you're working with? Do you have a primary care physician? And asking them if they would be willing to sign that consent. Because later down the line in treatment, if you find something out, it might be a little bit more difficult to get them to sign it at that point. Or if you find out in like a phone call or something like that with the client, you can't then immediately call their doctor. You have to wait till they come in and can sign the consent form, or you can send it to them online. So there's like a lag. So in some cases, it's really good just to have them to sign it, right at the beginning. And especially if they're coming in with any kind of medical concerns as like their primary thing, like if they have like long-term medical conditions, or if they're coming in because of like sexual related issues, you might say, I think it would be a good idea for us to be in communication. The other thing is if the clients don't have specialists that they work with, or they don't have like a primary care doctor, it's also a really good thing to like get to know some of the providers in your community, so that you then have that referral base. So you can say like, oh, you're coming in for this specific issue. Like let's say it's a female coming in with sexual related issues. I feel like it would be a good idea for you to get like a full exam and talk to a GYN about this. And they say, well, I don't have one. I don't know where to go. You can say, oh, I have, you can choose anybody, but I do have a list of, GYNs that I'm already in partnership with. You can refer them to there. And then again, you can have them sign the consent if that seems appropriate. And so like in my situation, I work with a lot of women going through like infertility and pregnancy loss and stuff like that. And I work with trans individuals. So I've tried to connect with like OBGYNs. I've tried to connect with endocrinologists, anybody that might urologist, anybody who might specialize in some of the things that might be important to my clients, so that then I can refer to them, and potentially they could even refer to me. So really it's a good relationship to have in general. And there's just sort of different ways you can go about doing it.
And like, for example, in your case, like for the doctors, the specialists that you were, you may refer some of your clients to, like how do you approach that specialist, or how do you go about making that connection?
Again, there's lots of different ways you can do it. So what I did when I moved to the area I live in is I just did a Google search. Like I was like, Google search all OBGYNs, Google search all endocrinologists, whatever. And then you can start by sending them a letter. That's less likely to get as much attention, but it's something very simple. You can also stop by the office, because usually there's some kind of like office assistant, like a person who answers phones and stuff like that, or some kind of nurse that might have time for you to talk to them. So then you might bring like brochures or business cards. And you can even like, a lot of times like different medical offices will take treats. Like they'll send like a basket of candy or like a little fruit basket to an office, and it'll say like, like, I'm new to the community. This is my information. I would love to talk at some point. Or you could also go in and try to schedule an appointment to talk with some of the doctors. Like, do you have like staff meetings that I might be able to come to talk, with you about? Or you could also offer things like, are there trainings that you think that your staff might need that I could help provide? So like offering like a trauma-informed, like continuing education could be good, where you go in and talk about how trauma impacts individuals and how they can be better trauma informed in, medical work with clients. And so, you try as much as you can to just foster the relationship, get them to know your face, get them to know your name, and then see what you can offer them as well. Like, again, like, hey, I'd love to come to a staff meeting and talk to your staff, or I'd love to do a training for you guys, or can we partner on something? And that usually is helpful to make that connection too.
Okay, thank you.
Yep.
I had a question. Why are mental health professionals who have master's degrees and are licensed are not eligible for the certified sexual counselor credential?
They can. They just have to go to specialized training for it. And then when they go to that specialized training, they have to have supervised hours specifically with sex therapy. So, you know, like, again, like I'm already licensed, or I already did my supervised hours. If I was to decide I want to get this certification, I would have to do all of the schoolwork necessary, and then I would have to find a supervisor who could supervise hours doing sex therapy. And then I would apply for the certification, and then ASECT would decide whether or not they would accept my application. So it is a little bit of a process, which is why I think that some providers haven't done it. Like for me, I chose to get my PhD instead. I was like, I can't do both at this point. So I chose to do my PhD first. At some point, I might get to the point of getting the certification. But you can also get ASECT certification, like if you're like a nurse or something like that, they have like different levels of certification. So they have one that's like the mental health provider that would do sex therapy, but then they also have like sex educators that are certified and things like that through a couple of different disciplines.
Okay. Because I think that was one of the like true and false questions, and I've seen it in the book because it talks about how is it different from becoming a sex therapist then? Because I think there's a difference, right, between the certified
between sexuality counselors and sex therapists.
Okay.
Okay.
Yeah, sex therapists. Because like I think this question is false. The mental health professionals who hold a master's degree and are licensed in their state are eligible for certified sexuality counselor credential. And I think in the textbook it says that they're not over
Okay,
here.
quick, tell me the page number so that I can look at it.
Page 13.
Okay. Okay. Here's personal training. Oh, credentials.
No, I don't think it's page 13. I'm sorry.
Oh, okay. So are you talking about the middle paragraph where it says credentialing and professional identity issues?
Yes, I believe so, but I'm not finding the paragraph because this question made me come back into the textbook, and it said something that like they're not eligible, like
Okay.
mental health professionals who hold license or not, and then it said something about like the sex therapists that they are. So I just want to know the difference, like why.
So with this, the state licensing boards don't have any kind of regulation over sex therapy. So, like, for example, I'm licensed by the Florida Licensure Board. If I were to become a sex therapist, the licensing board would have no like oversight or anything on the part of my work that I do as a sex therapist. ASECT, which is like a national organization, actually an international organization, would be the one that has like the regulations over my sex therapy certification. So it's kind of like two different things.
Okay.
So as a counselor, like as a licensed counselor, we can say that we practice sexuality counseling, but we can't say we're a sex therapist. And if we get the credentials to be a sex therapist, but we're not licensed, we can say we're a sex therapist, but we're not a licensed counselor. And so it gets kind of confusing because the terms counselor and therapist are used interchangeably so often, and also because we don't have national licensure, it goes by the state, whereas ASECT is like a broad, you know, national, international certification process. It gets a little confusing because there's the same thing with supervision. Like there's the NBCC qualified supervisor that you can supervise in any state, but certain states like Florida require you to still be a qualified supervisor. They don't necessarily care that you're NBCC certified. They want you to have the qualified supervision. So it's just the difference between state stuff and more broad national organizations.
Okay. All right. Thank you.
Yeah, so because I'm going to tell you the truth, there is a question on the exam that asks what's the difference between a sexuality counselor and a sex therapist, right? And the important thing to remember is that, you know, one could be licensed in the state but not have their sex therapy certification, whereas a sex therapist has that certification, but they may not necessarily have state licensure. And they're regulated by two different bodies. The licensure is regulated by the state, and the certification for a sex therapist is governed by ASECT.
Okay.
Mm.
All right. All right. Thank you.
Yep. What other questions do we have?
Dr. Christina, so when it comes to now that we're talking about sexuality counseling and sex therapy, like if we say, for example, before we get licensed, like during our years, like once we graduate from the program, like when we're seeing a client that comes with sexuality related concerns, like how do we know that this person maybe needs to see a sex therapist and not see us as that doing sexuality counseling with them is not enough?
Okay. Sometimes it's a little bit tricky. You know, when you do that intake, you know, maybe the client might not be giving you all the information. So they might give you a little bit and you might think like, oh, okay, this is fine. I can work with this. You work with them for a few sessions and you realize, oh, wait, there's something more here that's really out of my scope of practice. And that's the situation where you would refer out. So one example that I give is that I've had a number of cisgender males come to me because they would talk about like not being able to like maintain an erection during sexual activity, and they were really concerned about this. And we would kind of talk a little bit about, so like, you know, what's happening in your mind? Like, are you being mindful in the moment? Is your mind going all over the place? Are there different like beliefs or anxieties you have about sexuality or sexual behavior? And in a lot of those cases, it really was like overthinking things and anxiety. So using some like CBT techniques and using mindfulness and helping them to learn mindfulness and train themselves in mindfulness, they were able to work through that issue with their partner. So in that case, it was within our scope of practice, right? Because it's just like, it's almost just like treating any other anxiety issue, right? You use the techniques that are for the anxiety, you help alleviate that, and then they're able to perform the way that they want to in those situations. But if they're like, you know, like I can't even get an erection at all, it's nothing that I'm thinking, like I feel like it could be biological, I don't know, or there's sexual trauma that could be, you know, wrapped up with it, that you just feel like this is too much and I'm just really not sure, then that would be a situation to refer out. So it just depends on
The case.
yeah, like the amount of stuff. And if you feel like this is just way beyond my knowledge at this point and my expertise, then you need to. There's a lot of disorders with women too, like I don't know how much we've talked about it yet, but and of course, like the names are like escaping me, but some of the ones that are diagnosed in the DSM for women that it's, you know, it's probably out of our scope if you're not specialized as a sex therapist, like the pain disorders and stuff like that. You know, sometimes they could be related to trauma, and if we help process the trauma, it can get better and they can be okay. But in some cases, it's beyond what we're going to learn in a master's program.
Okay.
I have a question.
Mm-hmm.
So you mentioned sexual abuse. So is sexual abuse considered something that usually is worked with than a sex therapist, or is that something that's handled normally? Because
yeah, it's something that any of us could be trained to do and any of us work with. I think where it becomes a specialty is like if there are those like diagnosable sexual issues, and they may or may not be related to sexual abuse, then you might want to refer it, just because there are like the pain disorder. And again, for some reason I'm blanking on the diagnoses that are in the DSM-5, but if it's going along with that, they meet the criteria for one of those, it might be a little out of our realm. But if a client comes in and says that I'm having trouble processing a sexual trauma, or, you know, like something happened recently where it's bringing up trauma from the past, I mean, all of those things are definitely within, you know, our ability to work with. And you'll be, you know, I mean, again, you can get specialized training in sexual abuse and sexual trauma after you graduate as well. But when you graduate, you should be able to work with those populations.
okay.
I have a question. So I understood what you said about the whole licensing and the state licensing, but I actually found the section that I was a little confused about. It's on page 15 underneath the credentialing options. And it states mental health professionals who hold at least a master's degree and are licensed in their state are not eligible for the certified sexual counselor credential as they're only eligible for credentialing as a certified sex therapist once they meet the requirements. So that's what's like
Yes.
confusing.
Yes.
Like,
So like I said, ASECT has different levels of certification, and the certified sexuality counselor is actually a lower level of certification. So once we hold a master's degree and are licensed, we're above that level. So we would seek out the sexuality therapist.
okay.
So like if you were to go to ASEC's website, it like explains the different levels, and this certified sexuality counselor is people who don't hold the master's
like a degree.
don't hold the license. Yeah.
Okay, that's more like a certification. Like if you wanted to be like a peer counselor and do like those short certifications and stuff. Okay, so that's why
Yeah.
we're not eligible because of our degree.
Correct. We're like above that educational level.
Okay,
Yeah.
but I mean, since we are above that educational level, like we couldn't be automatically like granted that, right? Like just because.
Because it's still specialized knowledge.
Yeah. Yeah,
It's and essentially like once you're at the point where you're licensed master's level counselor, you'd want to go get the sex therapist certification anyway, because it's sort of the I don't want to put it on a hierarchy, but it's kind of like the higher one. You can do more with it. So it makes sense to get that versus the sexuality counselor.
Okay, now I understand.
Yeah.
I was really confused about that because I was just like, why can't we like take a course in this? You know, it just seems like we were restricted from like taking a course, you know, taking the certification for some reason. But I get it now.
Yeah, it just means that you're beyond that.
Yeah, it doesn't explain that like in this paragraph. But
Yeah.
thank you. All
Yeah. It's a little bit hard because like ASECT is not an organization that is specifically aligned with like ACA, like the American Counseling Association, and they're not really necessarily connected with APA either, the American Psychological Association. And so they're kind of their own entity. And again, like with the language and things like that, it makes it a little bit complicated. And ASECT also has certain beliefs that like as for example like as counselors there are many counselors who believe that sex addiction should be a diagnosis in the DSM. We believe that it exists, but then under ASECT, if you become like a sex therapist or whatever under ASECT does not believe that sex addiction is a thing. They don't believe that you can actually get addicted to sex. And so there's just little things like that, like nuances that are a little bit different depending on organizations and stuff that I think make it a lot more complicated than it needs to be. And honestly, a lot of human sexuality courses don't even deal with ASEC, like don't even get into it. Because there's so many people who are going to take this course and never get ASEC certified. But I mean, I do like that this book addresses it because it helps, I think, you know, bring up that topic in case people are interested in getting further education in that area.
Okay, thank you. And on the topic of sex addiction, what defines that? Like, what are their like characteristics of like, you know, knowing someone, you know, like someone that has like maybe like a healthy or like active sex life to like, where's that line at where it's like an addiction?
So even with like substance addictions, there's not a really firm line. It's how you sort of interpret that like criteria on the diagnosis. But because sex addiction is not a formal diagnosis in the DSM, there is no real line because we can't diagnose clients with it, right? And so part of the reason that it's never become a diagnosis is because there's so many people who are like, this is not a diagnosis. This is not something that exists. We, you know, they have these issues because of other stuff that they're just playing it out with, you know, sex or whatever. And so it's really hard to define because of that, because, you know, it's up to interpretation. We don't have it in black and white. However, when you look at the work of like Patrick Carnes, he is the one who kind of initiated our field looking into sex addiction. He was the first person to create a sex addiction assessment tool. Even his daughter has taken on his work and she continues to like research in this field. there's a lot of complaints about the assessments that they do because they're normed on cisgender heterosexual white males. And so it doesn't allow for any diversity with, you know, race, religion, sexuality, gender. And so you can give anyone that assessment tool, but in reality, it's only normed for one very distinct population. And so this world is just still not, it's just not a very clear issue, I guess. There's lots of thoughts all over the place on sex addiction.
And then, like, from your professional opinion, right? If you have someone that comes in and like you think they have like, you know, a sexual addiction, like just from you personally, like what are the identifiers of that? Like,
again, just like other addictions, it would be how much of an impact is this having on the person's functioning? So are they having relationship issues, job issues, money issues? Are they having like negative feelings of like shame and guilt due to it? Are they acting in a way that's harmful to themselves or others? How much of their time is spent in planning to act out and covering up their acts and engaging in the acts? So it's really like to what extent is this causing some problems with functioning or some other issues in their life? And I think that that's kind of how you look at any other addiction, you know, like whether it's alcohol or whatever, is what is their level of functioning? And could it be better if this were not an issue?
okay.
Yeah.
All right.
I mean,
Thank
same
you.
thing with porn addiction as well. I mean, porn addiction is not something we diagnose either. But it's similar. Like, are they spending lots of money obtaining it? Are they thinking about using it constantly? Are they getting in trouble at work because they're using at work and not getting their work done? You know, are their relationships ending because, you know, they're spending so much time using this, and maybe not able to actually function with another partner because, you know, they've got so ingrained with the pornography. So it's just what level of distress is there, what level of functioning is impaired.
Okay. Thank you.
Yeah.
I have a question.
Okay.
How because they mentioned it in the cisgender in the book, they use that term in the book, and then you've used it too. What's the proper way to use that? Because someone, like, I have a friend who told me, like, his therapist had identified as a cisgender, something like that, as a woman, and I didn't really understand what that meant.
Okay, so when we're born, we're assigned a gender at birth. Okay, and so, for example, when I was born, I was assigned female at birth. And
based on your anatomy.
Right. But we don't always know the full internal workings of a person, right? Like, I was born and it was like, do they have a penis or a vagina? But they didn't look at hormones. They didn't look at the sexual organs inside of me. Like, do you know what I mean? And then obviously when I go through puberty, there are secondary sex characteristics that may not occur because of those different things. And so instead of calling it like, I was born a female, it's I was assigned female at birth, if that makes sense. So it's just like kind of a change in the terminology. So what cisgender means is that the gender you were assigned at birth and like raised in is the gender that you identify as. So I was assigned female at birth and I identify as a female, so I am a cisgender female. And this would kind of be in contrast to an individual who maybe was like assigned female at birth, but identifies as is either gender nonconforming, gender fluid, or transgender. So they might have been assigned female at birth, but they identify as a male, so they would be transgender. So I don't like to say that it's the opposite of transgender, but sometimes that helps, like, to remember what it is.
I see. Okay. Thank you. Thank you.
You're welcome. Any other questions?
I'm looking. I do write like little questions on the sides of my book. See what I have.
I have a comment. It's more of a comment that it's something that surprised me when I first learned about it, and it still does. So when in the section about sexual interactions or relationships with clients or supervisees, this is in chapter 1. It states here that sexual misconduct is one of the more frequent ethical violations reported to the state professional and credentialing agencies. That's shocking.
It is. The cases that go in front of the licensing board, the majority of them are boundary issues. And so it could be sexual, it could be other boundary issues, but yeah, it's one of the reasons that a lot of people with, I don't know if I want to say a lot, but people within the field are really pushing to have courses like this required in all states, because it's important to understand these issues and how to talk about them. Because in some cases, maybe the client and counselor were engaging in, you know, a conversation about something that was related to sexuality, and the counselor wasn't really knowledgeable or able to deal with what was coming up and crossed a line or whatever. And so it definitely is something that needs to be talked about more, needs to be explored. And also there's so many states where there's no supervisor credentials. So I came from Pennsylvania. The day I got licensed in Pennsylvania, like the next day I was given a supervisee by my company. Like there was no transition. I went from being supervised to supervising people. And that's also an issue because, you know, like while, you know, most of us would probably say, okay, I know that there has to be boundaries here, they were never explicitly talked to us about. Whereas in Florida, you know, you have to go through the 16-hour training or have like a doctoral level course in supervision so that you can learn all the ethical pieces. But it's not really a surprise to me that there's issues between supervisors and supervisees, because in so many states, there's no credentialing for supervisors. It's like literally you just move right from one to the next, and that's it.
Okay. It's I have to say that it's very puzzling to me how, I guess, I mean, we've been taught in the ethics class too that we took for this program that that's like a big no. You don't engage with the client in any kind of sexually inappropriate behavior.
And
so
I don't know, like, so it's been a while since I've taken ethics. Like one of the things that could be really important to talk about in the ethics class is, so what if you do find yourself sexually attracted to a client? What do you do? And I think that some counselors never really have that discussion. So when they find themselves in a situation where they're really either like affectionately or sexually attracted to a client, they don't know what to do with that. Like, do I tell the client? Do I keep them? Do I refer them out? What do I do? And the reality is it would only be, for the most part, self-serving to tell the client. Like, why would you tell the client you're attracted to them? The best thing to do is refer them out to say there's a conflict of interest or whatever, or to process it with your supervisor. What is it about this client that attracts you? You know, do you feel like you're able to recognize that and then separate yourself from that when you're working with the client? Can you still be effective with the client? And it can be tough, but I just don't think that, you know, it's told like, don't do that. But then when you get into a situation of like, okay, it's happening because I'm feeling it happen, I'm afraid to tell a supervisor, are they going to get me in trouble because I have this attraction, or are we going to process through it? And it's hard. I mean, as a counselor, that can be kind of scary to feel like, you know, if I tell somebody that I'm attracted to this client, like I could lose my job, I could lose my license or my ability to get licensed. And realize that, no, this is something that you do need to talk to your supervisor about, and that hopefully your supervisor is experienced enough or knowledgeable enough to process it with you and not like reprimand you for something you can't help. Like we can't help who we're attracted to. I mean, it happens, you know?
Yeah. No, that's basically what you said is basically what we learned in our ethics class, that we need to consult with a supervisor. We need to talk to someone about it and possibly refer the client out if needed. If we feel that that we won't be able to do like an effective job with the client. Okay, thank you.
Yeah.
And does it happen more with like sex therapists? You know, crossing these boundaries with client to therapist? Because I would imagine like you know, as a clinical mental health counselor, like it may come up like the topic of sex and stuff like that. But if you're a sex therapist, like that's what you're talking about, like every single session, you know. And of course, like naturally, you will come across a client that you're going to be attracted to, like that you can't, as much as you want to stop it in your mind. So does it happen more often for sex therapists than like other like counselors, mental health counselors?
So I don't actually know like the statistics based on like who, like what population it happens with more. But one of the things that you have to remember with certified sex therapists is they actually have a lot more hours of supervised training. So like if I'm doing sex therapy certification and I'm doing hours under a supervisor on sex therapy, I'm constantly processing that with someone about like, you know, this is the issue the client brought to me and this is what made me think and this is how it made me feel and this is how I reacted to it. And so in a way, you're actually getting a lot more direct supervision related to those sexual topics and related to how you were, you know, feeling it and expressing it within the session, that in a way it actually might be a benefit to like prevent that from happening. So again, I don't know the exact statistics, but just knowing that there's that extra supervision specifically around the sex therapy that you'd be doing, that it seems like that would be like a protective factor for it not happening, because you'd be held accountable to someone.
Yes, yes. Okay. All right. All right, thank you.
We have about 10 minutes left if anybody wants to throw out any more questions.
Is there anybody else on here with us? Oh yeah, there are people here.
Yeah.
Can you explain more the group project to us? Can you go over that a little bit more?
Sure. So we have two group projects, right? We have the interview and we have the paraphilia project. So the interview, I put up a thing that has like all the interview groups. So what you would do is you would contact your other two people, and you could like, depending, I mean, I don't know if you all live like right in that area. I know like a lot of your classes are face to face. So if you're able to get together physically, but if not, you could do it over like, you know, Skype or the phone or whatever. It'd probably be best to be in person, or at least to be able to see each other, because one of those three is going to be the observer each time. And so the observer can watch body language and stuff like that. So if it's over the phone, you can't really do that. But what you do is like you take turns. So in this first scenario, like person A is the interviewer to person B, the interviewee, to person C, the observer. And then you switch roles. So person A becomes the observer, B becomes the interviewer, and C becomes the interviewee. And then you rotate again. So each of you has a time to ask the interview questions, be the interviewee, and be the observer. Now, the list of questions at the back of the syllabus are like ridiculous. You're never going to get through all of them. So what you want to do is like maybe pick one or two from the different categories. You know, if someone gives a really long answer, then you might ask them less questions. If somebody gives relatively short answers, you might ask them a few extra. Don't feel like you have to answer any of the questions that you're asked while those interviews are not recorded, and you're not to like disclose anything that any of your partners share. If you still feel like it's not totally a safe environment and you don't want to answer a question, just say, I don't feel comfortable answering that, and move on to the next one. And then with that said, as the interviewer, don't push someone to answer something that they're, you know, pretty obviously uncomfortable with or don't really want to answer. And then when you write up your paper, you would basically break it into three parts. You would write, okay, so as the interviewer, you know, and there's some discussion questions there, like reflection questions that I want you to look at. Just what was your experience as the interviewer? Were you comfortable, uncomfortable? What was difficult for you? What helped make it easier? As the observer, what did you notice? What were you kind of sensing and picking up? And then as the interviewee, how easy was it to talk about it, your own personal stuff? And it also gives you an experience that maybe clients might be feeling when you're asking them these questions. So you can kind of reflect on that. So does anybody have any other specific questions about that project before I move on to the paraphilia one?
Thank you. That was extremely helpful.
Okay. So the paraphilia project, you're going to be put into groups, which I think I might have already done on Canvas. And so with your group, you're basically going to come together and do a presentation. So in the face-to-face class, you would do like maybe a PowerPoint that would be partially lecture, partially maybe group discussion, or like, you know, show some videos, make it sort of interactive. But since we can't totally do that online, I'm working with she's this woman, she's like the IT person who works on the classes with professors. She has a couple different programs where you might design kind of like a PowerPoint, but like maybe after this slide the video stops, like you record yourself talking and whatever, the video stops and it asks like a question, like you would do in a classroom, like, oh, what are you guys' thoughts on this? Or like answer like this multiple choice question based on what you've already learned in this presentation. And the reason that I want to do it that way is because part of your credit for the fourth quiz is based on your participation in reading each other's or viewing each other's presentations. So how am I going to prove that you watched each other's presentations? So the programs that she's aware of, it records your interaction. So like, again, you start watching it, you can't fast forward through it, you can't move past those stop points where it asks those questions, and then it would record what are all the students that participated in this particular lecture. And so each group would create one of those lectures. So I think there's 8 different groups. So you would obviously create your own project, and then you would participate and view the other 7 people's presentations. But I don't know enough about those programs yet to share with you. So I'm supposed to be meeting her in the next couple weeks so that she can sort of teach me the programs and how to use them. And maybe even if she knows of some like good like video tutorials so that you guys can have that, because I wouldn't want the media that you're putting this presentation on to be the barrier between you turning this in or not, right? Because the idea is to get the information, not to learn this program. So if I find that they're too difficult or like they're just not gonna work, it's gonna take you guys too much time, then we'll go back and we'll just say, okay, do a Prezi or a PowerPoint or whatever. But again, this way it allows you to make sure that you're participating in those. I know that you've participated, you've gained the information so that you can get credit for that fourth quiz. So what questions do you guys have about those presentations or that assignment?
Not a question, but there's a wonderful program. It's called Nearpod, Nearpod. That
Okay.
sounds like exactly what you're explaining.
Okay, and that might be one of the ones that she had named 2, but I don't remember what they were offhand. So I'm trying to find a pen. Put this down. So you said MEARPOD? Okay, so I'll look into that. And like I said, it may be one of the ones that she's going to discuss with me. But so the only reason I haven't talked a lot about that is because I'm just not sure what format you are going to have it in. But I mean, in the meantime, if you wanted to meet with your groups so that you maybe divvy up responsibilities or you kind of look at what information you need on those different paraphilias and start working on it, you can definitely do that. And so you can get it started. It's just what format it ends up in is going to be the big question. Okay, we have about 2 more minutes. Any last questions? I mean, of course, you can still email me and stuff, but. All right, thank you guys. I really enjoyed getting to talk to some of you face to face or even, over the phone. And like I said, I'm going to change it up a little bit for the next quiz. And if that goes well, then that's how we'll keep it for the semester so that it's not so like squished in a short amount of time. So good luck on the quiz. I have no doubt you all will do really fabulous.
Thank you.
All right, thank you guys.
Thank you.
Have a nice weekend.
Thank you.
Bye.